Hello, I'm Dr. Malescu, and today we're going to talk about Ehlers Danlos syndrome. It's a very common situation with gymnasts and dancers. It actually glorifies the situation of hypermobility and flexibility. So it would make sense that individuals who have Ehlers Danlos syndrome would excel in these venues, in the sport of gymnastics and in the performing arts such as dance. So Ehlers Danlos syndrome is a grouping that is genetically based, where there's a collagen disorder. And the collagen mutation, there's a gene, there's many that cause a mutation in the structure of the collagen, making the skin hypermobile, and then your joints hypermobile. I happen to have and you could see the excess skin, and it really does hang more than usual. And then the hypermobility in the joint. Okay, so it makes one very flexible, and it's beautiful when you're a gymnast and a dancer. But as you get older, as you age, a lot of the hypermobility in the joints cause osteoarthritis. And many, by the time they're 35, 40, 50, they get knee replacements, hip replacements. A lot of patients end up with chronic back issues, disc herniations. And then the hypermobility is not just, your joints and your skin and muscle. It can even be a vascular involvement where you have your mitral valve that's not functioning. You can have detached lens from the ligaments that hold the lens up in the eye. There's a plethora of syndromes associated. So let's go over a little bit. This PowerPoint is from the Ehlers Danlos Society, readily available to everyone. I'm not going to go over all of the items because it's a PowerPoint that's, I think, 50 slides. So, but I'm just going to give you a little bit of the highlights, and I don't want to read off the PowerPoint because you could read this on your own. But what is EDS and hypermobile spectrum disorder, which is a milder version of EDS. So like I said, it's a connective tissue disorder, genetically based. There are a couple of gene mutations that cause this connective tissue, the collagen, to be altered. So again, as I mentioned, I showed you my elbow. I could show you my back and knees, but I'm not, because it's going to freak you out how flexible I am. Just go to my channel. You'll see it's great for being a yoga teacher and a gymnast and a dancer, but I've already had both my hips replaced. I have herniated discs. I've already had eye surgery to replace. I have a lens replaced. So there are issues. I even have a mitral valve regurgitation, and it is associated with this Ehlers-Danlos syndrome, EDS. I'm going to call it EDS for short because it's got a long name, and it's, in conversation, it's just a lot easier. So I happen to have the hypermobile EDS, and it's usually a clinical diagnosis, but you could do genetic testing. And the clinical diagnosis is there are a number of things that you look for. And if it's positive on a clinical exam, then, you can make the diagnosis. But if you want a confirmative diagnosis, then obviously genetic testing is the best way to go. All right, so it can be inherited. And it varies in terms of what it affects and what causes, it has. So again, to circle back to what I mentioned, the tissue fragility, delayed healing, hyperextensibility, like the skin really extends beyond normal. So like I have a sweater on now, but I can tell you my skin really stretches pretty far. It gives us a youthful look, so it extends our appearance in terms, we may look more youthful, but unfortunately, the other issue on the inside is that you're not very youthful because the joints, early onset osteoarthritis, and it's like equal opportunity for everyone. It's any ethnicity, any race, man or woman. I've seen hypermobile gentlemen. You could see them in Cirque du Soleil. This is where they thrive, right? Doing their contortionism, right? So the strength of the tendons and ligaments are severely weakened. I should have got the memo, but I didn't get the diagnosis till middle age. I kept spraining my ankle probably about at least 5 times in my teenage years. And it's also seems to be aggravated by the estrogen surge and progesterone. And during pregnancy, it gets really bad. So because the hormones cause even more ligamentous laxity in females. So anyway, so those are some of the things you want to look at. Now let's look at, let's go over here, genetics of it all. So these are all the genes, the genetic basis, and this is how you can inherit it. You can have the classical EDS, and these are the gene sequences. And then there's the cardiac valvular EDS, which I mentioned causes heart valve disease, whether it's the aortic valve, the mitral valve. Vascular EDS, which is more rare, but this is the most common, hypermobile EDS. This is pretty much every gymnast that has symptoms, or any dancer that has symptoms, it's hypermobile EDS. Unfortunately for us, we don't know the gene yet for it, so we don't have a genetic basis for it. But for the other forms of EDS, you can do a genetic test and find out which gene sequence has been altered, or it is a mutation causing EDS. So by process of elimination, if you have none of those, but you have all the clinical findings of EDS, then thus you have hypermobile EDS, okay? So anyway, the symptoms, again, as I mentioned, joint hypermobility, fragile skin, it's very flexible skin, flexible joints, easy bruising. The scarring is pretty delayed in terms of it's called, the scarring is going to be hyperpigmented. So that is also an issue, but also the hypermobility with the scarring and delayed healing is definitely there, easy bruising. And so that's where we're going. What else? In terms of the severity of it, you can go from, delayed healing to severe issues like, ruptured bowel, which is life-threatening, rupture of the uterus. And so the ones that really have terrible situations with the vascular EDS, they can have aortic aneurysms, aortic dissection and rupture. And so they're going to have a reduced lifespan. One thing is for sure, and this will also be a memo if you're one of those people that you're like, hey, maybe I have it. If you tend to run low with your blood pressure, you might just have vascular EDS. So if you're like 90/60 on average, double check and get checked out. I would say the Mayo Clinic is really good. And Shan's Clinic. There's a lot of places where you can find a specialty clinic that can diagnose you. All right, so your classical EDS is going to be hyperextensible skin or hypermobile skin, hypermobility of the joints, often dislocating. My hips would click, and that should have been a memo. My hips would literally go in and out of the acetabular socket as I was performing gymnastics. So, and if I'm sitting cross-legged, sometimes my knee pops out. So there's all kinds of little clues, poor wound healing. These are all of the things that you want to look for if you think you have EDS. All right. So again, the hip dislocations, you're going to be born with it. So I want to just reiterate and circle back to what I experienced with my hips. I have also coinciding congenital hip dysplasia where the acetabulum, or the socket, was flat and the femoral head was larger and it wouldn't fit in the joint. So it would pop out easily. Alongside the hypermobility of EDS, my hip would literally pop out in and out of the socket every time. Of course, that makes for a beautiful arabesque as a dancer or gymnast, but it really erodes away the cartilage, the hyaline cartilage, so that you're bone on bone by the time you're late 30s, early 40s. And I had chronic pain for about 7 to 8 years before I finally did both hips, one at a time, bilateral hip replacements. All right, so with that said, I'm going to finish up, and you can read this on your own, because like I said, I wanted this to be a micro lesson on a disease that is genetic. And since your project is on, genetic diseases, I thought I would share this with you, since I have personal knowledge of hypermobile EDS, which is what I'm dealing with. All right, I hope you like this presentation. And I will bring in more diseases as we move through pathophysiology. Take care. Bye.